Hi, my name is Rafael Andujar. I'm a pharmacist at a large retail chain here in Austin. The city is making a lot of strides to protect its citizens physically, mentally, and socially. The issue here is that there's a large student population. This is usually the time in life when most people feel like they're free and they feel like they're invincible. So this leads to a lot of disregard and safety measures that are being put in place. So, it's very prudent that they take these things very seriously and take the necessary precautions. At first, there was just the normal concerns with the whispers that were starting with things happening in China. But over time, as the gravity of the situation began to sink in, people began to try to stockpile on their prescriptions and other supplies. And as one of the most readily available healthcare providers, people storm us with questions. I answer over 60 phone calls in a day, all the meantime trying to maintain all the other things expected of me as a pharmacist, including verifying prescriptions, checking for drug interactions, administering vaccines, providing counseling. So it's been really difficult to maintain my quality of work at the same time trying to meet the demand. So we've done a variety of things, including maintaining the recommended 6 feet spacing recommended by the CDC. This includes at the registers. We're required to do mandatory cleanings of all surfaces on an hourly basis and mark that on, sign off on it to ensure that it's getting done. There has been a large demand for Tylenol, just for the fact that there have been some small studies shown in France and other places in Europe that show worse outcomes when utilizing NSAIDs, which are things like ibuprofen or Aleve, those items when trying to help with symptoms of COVID-19. So there has been a large request for Tylenol, but we've been doing our best to try to meet that demand. Outside of that, just other medications like hydroxychloroquine and azithromycin. We're kind of limiting the supplies that people can order in terms of what doctors can prescribe. They have to do a proper diagnosis so that we're not creating a shortage for people who need those drugs for other indications. Yeah, there's definitely some great things they can do. First thing, reach out to your insurance company, see if they're allowing some advanced fills, early refills, and things of that sort. Some insurance companies are doing it, some are not. Others you can do, check with your local pharmacy, see if they're offering free delivery so you don't have to leave your house as often, since there is a higher risk when going to the pharmacy since it's a sick patient population. And lastly, if you have the ability to fill for 90-day supplies, go ahead and do that. It decreases your trips to the pharmacy and it really helps out. Last thing I really want to hit home, please remain calm and understand that we are doing the best to help you all. A little bit of patience during these hard times will go a long way to helping us succeed and helping you.